You're tuned into Recovery TV, the voice of hope, with your host, John J. Tassoni Jr. Discussions and information on addiction and mental health issues. Here's your host with today's guest.
Welcome to another edition of Recovery TV, and I'm your host, John Tassoni. Narcan, please get it. You can get it at CVS, you can get it at Walgreens, you can get it at URI. It saves lives. Put it in your car, put it in your purse. Take it out of your car at night because the weather does affect it. My guest today is the world-renowned doctor, Dr. Skip. Doc, welcome, and thank you for joining us today. It's a pleasure to have you on. I mean, when I did radio, you were one of my guests all the time, but you know, now we're in a big time, Doc.
That's
so,
right.
Thank you for joining us.
That's
I want my viewers to know a little bit about Dr. Skip, formerly of California, now you're in Rhode Island, but professional football player from Harvard. You wrote a book, From Harvard to Hell and Back.
Correct.
Tell us your story.
I was born in Brockton, Mass. I went to Harvard College, Harvard Medical School after I graduated from high school. And at the end, I was a pretty good football player. I never actually I didn't go out for the professional leagues. I got a letter from the Chicago Bears scouting organization who said, if you come by and we'll take a look at you, and if you can make it, because I was fairly quick in those days, at outside linebacker, we'll pay you a whole $5,000 a year. And that was a time when Joe Namath first signed for $400,000. But if you don't make it, too bad. So
right.
I was not drafted. I decided not to go. I got that letter shortly after I got accepted at Harvard Medical School, and a lot of things intervened. And then, I mean, basically my father said, if you go and hurt yourself, I'm not going to pay for medical school. Well, okay.
All right, there you go.
Anyway, I decided I went to Harvard Medical School instead. Graduated from there and went into surgery. And I loved general surgery. I loved cutting gallbladders out in the old days when they didn't do it through a scope. It was a lot of fun to dig around in the right upper quadrant. There was lots of blood. And although you could, but you didn't often kill people quickly. You had to be very careful because if you tied off the wrong things, you're dealing in an area where the liver, the pancreas, the stomach, the small bowel all get together, and it can be horrible for the patient if you mess up. So it was always fraught with danger, not as sexy as neurosurgery or cardiac surgery, but you just haven't lived if you haven't had your hands in the right upper quadrant. Now they kind of do it all through scopes, and I'm not sure it would have been as much fun. I got hurt. I cut my right hand. By accident. I wasn't drinking or drugging. A salad bowl cut my hand, and I was right-handed. And I tried to stick it out in my general surgery residency, but emergency medicine opened up back then in California. I was at the University of California, San Diego, and it was becoming a specialty at that time. So I jumped right into emergency medicine because the hand was good enough to do emergency stuff. And for the next 25 years, I ran emergency rooms up and down Southern California. Enjoyed the hell out of it. Got hooked on Vicodin after a surgery, and at the sort of the height of my emergency medicine career, I ended up taking 150 Vicodin a day. And a lot of, when I wrote the book about this, I had one furious pharmacist who wrote in the Amazon section. It sold pretty well on Amazon 13 years ago. It still sells occasionally. He told me I must be lying because I have to die from the Tylenol in 150 Vicodin a day. And I wrote back politely and say, sorry, but you don't know what the hell you're talking about. Yes, it's dangerous, but not everybody has that susceptibility. I really should have died from 150 milligrams of hydrocodone, but you develop tolerance to that. So I got caught prescribing for myself something that could not happen today. With computers being what they are and people following doctors. And I lost my license. And since I had not been out securing any illegal drugs in the community, it was just me and friends that I sent out, friends, I don't think they consider me friends anymore, to get the 150. I was not arrested, but I could have gone to jail. Long story short, it took a couple of years to get clean, to get back some respectability, to take the exam and make sure that I hadn't forgotten everything I knew. And it was a natural jump from there into addiction medicine. So that's how I got there. I've been clean and sober now for I'm in my 26th year.
Oh, congratulations.
And that's it gives me insight into both sides of this illness. And one of the things that I talk about weekly at Zinnia, you're going to have a guest here later from Zinnia, is medication-assisted treatment and things like Suboxone and Vivitrol. And I know it from both sides. There was no Suboxone, there was no Vivitrol, but I know what the withdrawal is, and I enjoy taking care of patients because a lot of people who can be very good doctors don't really understand. It doesn't mean I hug them and kiss them. I say, listen, if you don't believe me, that's okay, but let's, So,
I've been there.
Yeah. So anyway, that's where I got here. Instead of my being, one of the great things that I wanted to do that I'm sorry I didn't do when I did not go to the Bears training camp, was I wanted to get hit by Dick Butkus. That would have been my story for the rest of my life.
Yeah.
Dick Butkus whacked me, and I survived it because he was at the end of his career. I did, however, my oldest daughter has a son, who is my grandson, who is 6'9", weighs 315, is fast, and got a 5-year full boat scholarship to Duke, and is in the name, image, and likeness, hubbub right now.
Yeah.
And he's at Duke. He was sought after in California by a lot. He's a young kid, but my heart sings every time I think about Duke and Duke football. He's pretty good ball player.
Right.
Yep.
So you do some work at Zinnia, you do some private,
Yep.
your private work. Obviously, since we had conversations before,
Sure.
it's progressively getting worse.
Absolutely.
The issue of, I was scrolling through Facebook today, I saw a couple of kids, again, in their 20s, must have got bad stuff on the street.
Sure.
When your patients come in, and you sit down with your patients and you have a conversation about them wanting to get better,
Right.
how difficult is it for someone who's been an addict for a long period of time, using multiple things that are on the street? How difficult is it for you to get through up here? Because you've been there.
Well, I'm not averse to telling you my story. On the other hand, I don't want to launch into it right away.
Right.
But a lot of people come in because of the book and because of other things, places I've talked and shows like yours. So they come in, and I want them to know that just because I know what's going on over there, I know that we're the greatest liars on earth. And we can convince anybody that we're telling the truth, no matter how ridiculous the story is. I said, so if you're interested in fabrication, you and I are going to get very far.
Right.
And so we're going to get a urine, we're going to see what's going on in your system, and it's going to talk about what's there. And part of the problem is people need to go inpatient to get detoxed much more frequently than they used to.
Right.
There are a couple of, naltrexone itself is a good opioid, it stops alcohol craving in 20% of people. If someone comes in and says to me, I hear about this drug on TV, and I'd like to try it because it says you stop drinking. And I say, well, listen, how much do we drink here? Now, that's the issue. And so my own history of minimizing drinking, I can say to them, well, I have about a six-pack every other day. I said, I'm sorry. If you have a six-pack every other day and that's what you're telling me, why don't you tell me the real truth? It's 2 six-packs a day and a couple of sleeves.
Right.
Please tell me the truth, because if you are in the 20% of people who are going to get this naltrexone pill that I give you to stop your craving, it is dramatic. And for the 20% of people who get on it within a week or 7 to 10 days, they come back and say, where the hell has this been? I don't feel any different. It's not an addictive drug. You can get off it by many studies in 36 months and not crave anymore. But you might have a seizure. That's the problem. So I got to convince some people who insist on not drinking that much. They say, well, then you wouldn't come in and ask me for an anti-drinking drug.
I want to talk more about this when we come back, because we have to go to break, because I know you're telling me the truth. And I got to tell you the truth. I have to go to break.
Yeah.
You're watching Recovery TV, and I'm your host, John Tassoni. We'll be right back after these messages.
And now back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, Kodak. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni. My good friend, Dr. Skip, is my guest today. Doc, thank you for joining us today. Greatly appreciate what you do for the community, what you do for patients. It's been a long road.
It has.
But, you know.
It's always my honor to come here and be with you because you help so many people.
Well, listen, if it wasn't for you and I doing what we do, there'd be a lot more people in the bad end of substance use and mental health.
Yep.
So we're talking a little bit about subscribing your patients, talking to your patients. Not every patient is the same.
No.
Right. Every patient, you got to do your due diligence in order to find out what John needs or what John doesn't need. So how, I mean, in your professional capacity as a doctor, how do you see through these patients? Because you said it yourself. They lie. They lie.
Right. It's with the exception of psychiatry, where they have to deal with a lot of lying people who are trying to get the lying better. Every other branch of medicine, people usually tell their doctors the truth. Right. My elbow hurts.
Right.
What are we going to do? How are we going to fix it? Does it still hurt? Is it still swollen? This business, I think, in an attempt to get a lot of general practitioners and others out there to prescribe medications, don't understand that they're dealing with people who are not telling them the truth. And we're such good liars that we can convince you for a couple of visits that we've been losing our medication, and instead of taking it, we've been selling it or whatever. Right. So it's tough, and that's what gives me an advantage, because the minute the story doesn't sound right, I start questioning on it, and then they usually cannot come across. I think that the estimation of what they're doing is often helped by what's in their urine, because we get a urine when we get new patients. Right. And a lot of people, not just the ones who were worried about withdrawing from alcohol and seizing, because alcohol is really the most dangerous drug from which to withdraw. Benzo's right close after, but alcohol's bad. The misery of withdrawing from opiates, and even with cocaine, people get really tired. The misery of coming off of opiates doesn't kill very many people. If you're 75 years old and you get a bad heart, yes, it can kill you, but it's actually your secondary illnesses. Right. So, but it will drive you to steal and ruin your whole family and life, but it won't kill you. So with alcohol, I won't just give them the prescription if I think they need to go in. And an alcohol detox can be done quickly, and then once you stop people from craving, that's okay. Right. So that can work fairly quickly. It's when they're using street drugs and there's fentanyl and coke and benzos in their urine, it really leads me to sending a lot of them in to get detoxed, especially to get off fentanyl before we get on there. But usually by the time they come in, they're willing to talk about it. And they will, when I bring them back to tell what's in their urine, they'll admit that they lied. I mean, so if I focus on, I'm not judging you here. I mean, you want
to help
you. Not only that, I mean, look at the way I embarrass myself in my profession. I'm supposed to be a doctor, so I'm the worst person to become an addict and then pretend he's lying. So I can say, so don't worry about it. I just you and I, tell me the truth. Just tell me the truth. That simple plea does more than you can imagine. And if they say something and I just go, really? And they go, well, not really. Okay. So that happens. I mean, it's just the experience of having lived, even though I was never officially homeless, I was homeless for a long time in California because I didn't want to go home and see my wife, who has been wonderful to me over the last 56 years. But that's how you have to be ready to tell them nicely that they're lying. And after a while, sometimes it can get not so nice. It's like, listen, let's stop this. I don't want to see you anymore. And a lot of patients still have this idea.
What happens
Yeah.
when you tell somebody that, I don't want to see you anymore?
Right.
Do they melt like a stick of butter?
No, they don't melt. Some do, but
Yeah.
not many. No, most of them are angry.
That they got caught.
They got caught, and they'll argue with me and see. They're so used to the system not letting them. God love methadone clinics. We could talk about methadone clinics forever, but they get away with so much. For example, in methadone clinics, it's like, you're not going to get rid of me. You're getting paid to see me. Okay. Unfortunately, there are a lot of people who have that attitude, and I say to them, I'm telling you right now that I don't want to hurt you anymore. And in the old days, you know, it was tough if people were on Suboxone, and that usually is not one of my patients, the patients that have problems. There are only so many people who could prescribe Suboxone. Now everybody can prescribe Suboxone.
Right.
So I tell them, listen, go see somebody else. Go get your Suboxone elsewhere. I'm not interested. Well, you can't do that. I've been here a couple of times. I absolutely can. You're not doing what I'm asking you to do, and you don't believe me. I have to say, I think ballpark, at least 50% of them are back within a month.
Yeah.
And because I try to make it, sometimes I'm yelling at them as loud as they're yelling at me, and I'm saying, just get out. Okay. But boy, if they call to come back, I'm milquetoast. It's like, hi, I'm glad you're here. But I'm not afraid to throw people out because I don't want to agree with them if it's going to kill them. And I think they know that.
Yeah, you know, and that seems to be the topic lately about the street drugs, all these drugs that are coming into Rhode Island, crazy stuff, animal stuff.
Yep. Yep.
It just boggles my mind that,
Kratom.
yeah, Kratom is
OH,
another
yeah,
one. I mean, they just legalized it. I mean,
Yeah.
I just shake my head. They legalize marijuana, we legalize kratom. What else are we going to legalize?
Right, yeah.
Benzos next and everything else.
Yeah.
And it's coming from the West Coast, as you well know, to the East Coast.
Yeah.
And we predicate our budget on substance use, gambling, and whatever else we do. None of the good stuff.
Yeah.
None of the good stuff. And to try to get, from my perspective, try to get into have conversations with the legislature about changing stuff. You know, we have a bill in this year to change the drug court, to change the name because of stigma.
Yeah.
We're going to make it the recovery court.
Yeah.
And it's happening throughout the country. But the things that these kids, and it's not all kids either.
No. A lot of older
it's,
people.
It's a lot of older people. And I want to talk a little bit more about that when we come back, because we're going to take another break. You're watching Recovery TV, and I'm your host, John Tassoni. We'll be right back with Dr. Skip right after these messages.
And now back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, Kodak. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni. Dr. Skip is my guest today. He's a world-renowned Dr. Skip. So thank you for joining us again. Thank you for what you do. You have all the respect in the world from me. I'll tell you, there's not many people I meet with your background and your thought process and your patriotism, and I can go on for the rest of the show, but
Thank you very
for
much.
what you do.
Yeah.
I want to talk a little bit about seniors.
Yeah.
A lot of problems with seniors when they have operations, and you know, they don't heal as well as everybody else, including myself.
Right. They heal more slowly.
Right.
They heal, but they.
But the docs only can give like
So many.
8 pills, and then you're on your way.
Yeah.
There's a lot of problems throughout the state with elderly folks, and the drug dealers now that focus in on these retirement homes, housing for the elderly. What do you say to somebody who has had an operation, the doctors only give you 8 pills? Should they in fact call them back, say, listen, I'm still in pain, I need more meds? What do we do? We got a minute and a half to go.
Yeah, I have a lot of doctors calling me for patients on Suboxone. What do I do about Suboxone? Although mostly orthopedic surgeons and others know a lot about it now. But what I try to tell them is, for example, with people on buprenorphine, I will say, listen, treat him or her like you treat any other patient. And if you think that they need 10 pills, 15 pills, 20 pills, and they're not in recovery, do the same thing for these people, because I'm telling you, they need the same amount.
I got to cut you out because we got to wrap.
Okay.
You got Kodak Live is next, and my guest next week is Christy from Zinnia. We'll see you. If you see something, say something. See you next week.